US Vice President J.D. Vance and the Department of Health and Human Services have highlighted what they call a betrayal of vulnerable American children by parts of the healthcare system. Following the release of a new HHS report on Thursday, titled Wolves in White Coats, the VP said certain hospitals and doctors pushed experimental gender treatments on minors, driven by profit rather than care. The report found these procedures generated tens of thousands of dollars in additional revenue per child, creating patients for life. To restore public trust and hold those involved accountable, Vice President Vance and HHS have referred the hospitals and providers named in the report to the Department of Justice for federal criminal investigation.
Parents bring their children to doctors because they trust them. They trust doctors to tell them the truth, and they trust hospitals to put their children ahead of ideology and profit. But when that trust gets violated, parents deserve to have a government that will stand up for them and for their kids and do something about it. Today, the Trump administration is proud to announce we're doing exactly that.
Today, HHS released Wolves in White Coats, a report examining pediatric gender medicine and insurance building across America. The findings raise serious questions about what families were told, what insurers were told, and how these procedures were built.
Today, Secretary Kennedy and I referred hospitals and clinics identified by this review to the Department of Justice and the HHS Inspector General for possible violations of federal law. These allegations are crazy and they demand investigation. When children may have been harmed and families misled, it's on those of us in power to find the truth and to seek justice for kids who were harmed by these doctors.
Under the previous administration, my predecessor, Richard Levine, promoted what he called gender-affirming care for minors, and there's nothing caring about that. These are sex-rejecting, mutilating, transgender procedures promoted by the Biden administration, and thanks to President Trump's leadership, we're changing course. The Wolves in White Coats report issued by my office at HHS examines a medical system that subjected children to profound interventions while serious questions remained about evidence, about informed consent, and about financial incentives. The report found more than 225 hospitals and health systems established pediatric gender programs nationwide where they preyed on vulnerable children and told families that their kids needed life-altering medical treatments, when what they really needed was compassion and counseling.
So many of these people got rich, not by doing what was good for the patient, but by actually mutilating these kids. It was disgraceful. And if someone broke the law, we are going to hold them accountable.
If the medical establishment failed children, we will confront that failure and restore the sacred duty to do no harm.
In Ottawa, more than 1,000 Canadians have applied to testify about COVID-19 vaccine injuries at the Allison inquiry, Conservative MP Dean Allison announced at a Capitol Hill, or rather a Parliament Hill news conference on Thursday. The non-partisan, citizen-led hearings run September 8th to the 11th and will feature sworn testimony from about 50 selected witnesses broadcast live. Allison called the response overwhelming, noting many applicants report lasting health problems and difficulty accessing support. Public Health Agency of Canada data show over 58,000 adverse events reported after vaccination, including more than 11,000 serious cases, while only about 250 of more than 3,500 compensation claims have been paid out. The inquiry aims solely to listen and create a public record, but will not issue findings.
When I'm interviewing these people, I ask them, every single one of them, a question that they don't expect. I ask, what is the most difficult part of this experience that you've had? And I'm actually expecting them to say, well, it's becoming a quadriplegic. It's the chronic pain. It's the fact that I'm on dialysis 6 days a week and I'm, 33. Even if I get a transplant, that's only going to last 10 years. I know I'm facing dialysis again. I'm expecting that, or the economic turmoil or the family turmoil. But most of them don't talk about that. When I ask them what the most difficult part is, most of them say the most difficult part has been dealing with the medical system. They almost all of them use the term gaslit. Basically, what they have is they're having these symptoms that is causing enormous suffering, disability, loss of function, and they're basically being told that it's in their head, or it's something else that it's not, and they're actually being treated like modern-day lepers. Some of them, like the doctors right out of the gate, this is vaccine injury. Everyone agrees it's vaccine injury, but they can't get specialists to help them because the doctor will refer to the specialist, and because the diagnosis is vaccine injury, it's almost like there's a fear. It's almost like they're untouchable. There's this unspeakable thing. We cannot say vaccine injury. We cannot treat vaccine injury. This has become the most difficult experience in their lives, is dealing with the medical system and then also dealing with the vaccine injury support program.
France's professional firefighters unions walked away empty-handed from a high-stakes meeting with Interior Minister Laurent Nunez on Thursday, declaring they received no concrete commitments on funding, staffing, or reform, despite an intense wildfire season that has stretched emergency services to the limit. 9 unions' representatives met Nunez at Place Beauvau, with talks reportedly lasting nearly 2 hours. It comes as calls escalate for nationwide protests on September 29th, aimed at highlighting chronic understaffing, inadequate equipment, and stalled modernization efforts. Emergency response continued yesterday without major disruption despite a one-day warning strike, as unions emphasized they would not put the public at risk.
I want to inform all Colombians that it is the coordination between the different sectors that will allow us to move forward. Therefore, led by the Ministry of Housing, in conjunction with territorial entities, mayoralties, governorates, and the business leaders present here, we are going to address and confront this crisis in 3 stages. Urgent, as the President already announced, we are providing a rent subsidy for families currently without a roof, and in the coming hours, a decree will be signed to provide relief for the payment of public utilities for these families in this moment of crisis. The business sector will join in with heavy machinery to help with the issue of debris. Likewise, Materials Bank will be established to generate timely solutions through the mayors and governors. And third, starting next week, we will have an army of professionals in the field carrying out an actual diagnosis of how many homes need improvement and how many must be completely rebuilt. And how are we going to rebuild them? In 2 phases. The first phase is focused on housing improvements coordinated so that everyone contributes and everyone wins. The private sector contributes, the state contributes, territorial centers contribute, and we help these families with home improvements or for homes already built by generating a subsidy through all entities that can coordinate with the support of banks at low rates, but in the same way, insurers will provide timely and rapid solutions so they can access housing. And in the long term, Mr. President, it is so that the more than 44,000 families who lost their homes can feel again that Colombia did not turn its back on them or leave them alone. Therefore, together with business owners, territorial entities, and each of the compensation funds, we are going to collaborate so that families can have access to housing, home improvements, and the public utilities we have lost. It is not an easy job, but when we unite, we can recover this land of miracles together.
In line with the video we just watched, in his latest update since a 7.4 magnitude earthquake shook Colombia on Monday, President Abelardo de la Espriella noted 281 casualties, 3,971 injuries, 379 still missing, and nearly 45,000 families affected. With over 10,000 homes destroyed, the president outlined his administration's three-phase recovery plan to address the housing situation. And for more on the latest international developments, stay connected to the Love World Networks.